In addition to all of the awareness campaigns that's happening globally, epilepsy and seizure awareness. Do you even know what it is? Do you know how they're intricately linked? And how is it all related to your brain and brain activity? Well, Dr. Wendell Bobb and Nichole Vanderpool, they're on the Morning Brew and here to tell us what you should be doing, and also that controversial topic, since Sanjay Gupta's series, should marijuana be used to treat seizures? Good morning. Thank you for joining us.
Good morning. Thanks for having us.
Now, Dr. Bobb, let me start with you. I know that you are part of the American Medical Fraternity, Neurology, all of the fancy names, so I don't want to get it incorrect. So I don't want to mispronounce the medical terminology this morning. You're an assistant professor of neurology at George Washington University, and you're also the chief of clinical
Neurophysiology.
Thank you for that. You know that was a technical one. But when we look at seizures and epilepsy, how is it all linked?
Absolutely. So a seizure essentially is when you have a surge of abnormal brain activity, and it can lead to abnormal behaviors or perceptions by the patient, and that's really called clinical manifestations. Now, epilepsy is when you have two or more what we call unprovoked seizures, or seizures that aren't caused by something such as drug toxicity or some metabolic issue going on in the body. So, and there are different types of seizures. When people think of seizures, they think of the most common type, which is called a generalized tonic-clonic seizure. So someone suddenly loses consciousness and they may fall to the ground and stiffen and start shaking uncontrollably. But there are other types of seizures that are often misdiagnosed. So, for example, about 10 seconds, you got to pay attention, but that child could be having seizures. So it's important that seizures are correctly diagnosed and people are aware that there are different types of seizures.
What are the different types of seizures?
Absolutely. So there are two main types. You have what we call partial seizures, and the new name is really focal seizures, but it starts in part of the brain, and you can have retained awareness. So for example, in my brain model, if we have a seizure starting in the motor cortex, or this part here, that's responsible for movement. So movement of our arms, our legs, our face. So if there's an abnormal surge of electrical activity in that part, what's going to happen is that the arm or the leg is going to move uncontrollably. And that person could actually have retained awareness. So they can be talking to you and me, and then they have, they're shaking uncontrollably. Then you can have the seizures where you have impaired awareness. So some people actually may have what we call automatisms, where they're smacking their lips, they're fidgeting their hands, and that can go on for a few minutes as well. Again, that's another type of seizure. And then we're used to the common type, which is the generalized tonic-clonic seizure. And most seizures start in a part of the brain and then spread to the rest of the body.
So epilepsy, automatically, if you're diagnosed with epilepsy, you will have seizures?
Sure. So epilepsy, so you can have seizures without having epilepsy. So epilepsy is where you have two or more unprovoked seizures. So for example, someone takes a drug of abuse, such as cocaine. That may cause an abnormal surge in electrical activity with normal brain cells. So they don't necessarily have to have epilepsy, but they can have a seizure.
And you look at the big question, which is what are pseudo or fake seizures? Because I know that's being addressed. So what is a fake seizure?
Right, I know.
I just have a little bit
it almost seems paradoxical, right?
Right?
Absolutely. So as and the current terminology is really what we call psychogenic non-epileptic seizure, or SPEL. So it's really not an abnormal brain, it's really not due to abnormal brain activity, but it's a behavior that can mimic a seizure. So it's important for someone such as a neurologist or someone who's trained to look at a video or to look at the brain waves, which we hook up using EEGs, electroencephalograms, and we can see if there's any abnormal activity. And usually those are due to some sort of deep psychological issue that manifests in behavior that can resemble a seizure.
Now, you look also at I know there are a number of questions that you will be addressing at the conference. So let's give some date, time, and details before I ask about the marijuana question.
Sure.
Sure. Our conference is on this Saturday, the 17th, at the Central Bank Auditorium. It starts at 3 p.m. sharp. And we have Dr. Wendell Bobb, our featured speaker, and we also have our local neurologists will be there as well.
Now, Dr. Bobb, you're looking at epilepsy and seizures, and since Dr. Sanjay Gupta did that series almost a decade ago, basically, I couldn't believe it was so long. Yeah, it's been a while. The controversial issue of medical marijuana, and particularly that young child who was the center character of that documentary that he did. And the parents said that they were willing to risk it all because they felt as though it was the only thing that gave their child any level of hope for a normal life. Is it now established that medical marijuana is an acceptable treatment for seizures?
Yes, so to be clear, medical marijuana is approved, at least by the FDA, for two types of seizures, Dravet syndrome, what's called Dravet syndrome, and Lennox-Gastaut. So they're two very devastating types of seizures that particularly happen with children. But to be clear, medical marijuana, so let's just go back to the raw form of marijuana. There are two main components. One is THC, or tetrahydrocannabinol, and the other one is CBD, or cannabidiol. And it is the THC component that's responsible for the psychoactive properties of marijuana. So those properties that cause people to be high or stoned if it reaches the toxic levels. However, the medical marijuana does not contain the THC or the psychoactive components, and that's the component that's used to treat epilepsy. Now, they have found, however, that it actually significantly reduces many other types of seizures. However, there are not too many studies that have been done and published, so it's only approved for those two types of childhood seizures.
So those are the questions. These questions and more that will be answered, and it's taking place at the Central Bank Auditorium. What is the most common misconception that people will have about epilepsy and seizures?
Absolutely. So, unfortunately, one of the common misconceptions is that it may be due to some sort of paranormal or spiritual phenomenon.
Do people still believe that?
There are people who do believe that, absolutely. That was written up in an article published here in Trinidad.
So what did they do, bring an exorcist out?
I understand, I know, but unfortunately that's one of the common misconceptions. But another one that I want to address is that putting something in someone's mouth who's having a seizure, because one of the myths is that people can quote-unquote swallow their tongue, and that is not possible. You can't swallow your tongue. So no spoons or any other objects in someone's mouth while they're having a seizure.
It's funny that I've heard that as well. So I'm glad that we had this conversation this morning. Thank you so much, and I wish you all the best in the conference. We'll take a short break. When we come back, we'll have more for you. Stay with us. This is The Morning Brew.
10% of people will have a seizure in their lifetime. And apart from convulsions, there are other types of seizures often mistaken for mental illness or even evil spirits. My name is Dr. Wendell Bobb, and I'm a triple board certified neurologist. And I am excited to return to my homeland of Trinidad to empower you with information about seizures as part of a free event hosted by the Seizure Awareness Foundation there. Join us at the Central Bank Auditorium, Saturday, November 17th at 3 p.m. See you there.